In our morning rounds, preserving your memory when you're young, a new survey out this morning shows people who are depressed, have high blood pressure, or don't exercise enough are more likely to forget things. This can happen as early as your 20s. Dr. Richard Isaacson leads the Alzheimer's Prevention Clinic at Weill Cornell, New York-Presbyterian Hospital. Doctor, good morning.
Good morning. Thank you.
So it's not just older people that we're talking about here with memory issues, right?
Absolutely. And this study is important because it looks at 18,000 individuals ages 18 to 99 and asks them, does your memory work as well as it used to? And they can still do all the normal things, but their memory still isn't as sharp as it was. And in this study, it showed that even people in the youngest age group, for example, 18 to 39, those with depression, low exercise, low education, as well as now I have my memory slipped. See, it can happen to the...
How old are you, doctor?
Depression,
enough exercise.
I think so.
Depression was the number one risk factor, right?
Right. Depression was the number one risk factor. And as a neurologist, I look at depression differently. If someone is depressed, they can't pay attention to something, their memory may not work as well. Although we also think that depression may actually be a risk factor for Alzheimer's disease.
But you say it's low serotonin, interestingly, right?
Serotonin is a brain transmitter, and we think that even if we treat the depression with a serotonin medication, it may actually benefit outcomes later on. We're not sure, though.
Mm-hmm. What about blood pressure?
So blood pressure is one of those silent killers. We know now that Alzheimer's disease starts in the brain 20 to 30 years before the first symptoms of Alzheimer's disease. Just like blood pressure is a lifelong illness, so Alzheimer's disease is the same thing. If we can treat midlife blood pressure, see a doctor, get educated, get informed, that's the way we can try to fight this disease and reduce risk.
Mm-hmm. Tell us where the research is leading us in terms of being able to both treat and postpone Alzheimer's.
Right, so the field is exploding. You know, we don't have a cure, we don't have a definitive prevention, but we can all take control of our brain health by making brain healthy choices, eating right, exercising, getting depression treated, getting your vascular risk factors in check. These are things that are important. Keeping the brain active.
But aren't these things we should do overall for good health in general?
I agree, although certain people are at higher risk. There's no one-size-fits-all approach. If you see a doctor and figure out what your risk factors are, that's when you can make a plan to address those specifically.
Yeah, and the higher your level of education and the smarter you are, that also cuts down the risk.
Exactly, and staying engaged in life, adult education classes, things like that.
Being smart.
Getting the blood pumping helps the brain.
Right. Yeah.
I like being
And
smart.
work the brain.
And work the brain.
Yeah, being smart. You ain't ever getting Alzheimer's, are you, Charlie? Yeah, he's just scary smart. Dr. Isaacson, we thank you. Thank you very much.
Thank you so much.
I notice he didn't disagree.